You may be thinking about undergoing a rhinoplasty, also known as a nose job, to enhance your nasal appearance. However, it's important to know that the rhinoplasty journey doesn't end when you leave the operating room. In fact, there's a lot more involved afterwards. So knowing what to expect after surgery, as well as knowing what to do in terms of postoperative care, are really important for providing you with the best potential results and the smoothest recovery. So we'll go into some more of that in this video. I'm board certified facial plastic surgeon, Dr. Delaney in Houston, Texas. Let's discuss further. Number one, perhaps the most important thing to recognize with rhinoplasty is it takes time to heal. While the healing timeline may vary a little bit from person to person, for the most part with primary rhinoplasty, meaning this is your first time undergoing rhinoplasty, it takes about a year. With a revision rhinoplasty, it could take a little bit longer, somewhere in the range of 2 to 3 years, just depending on your tissue and then the complexity of the rhinoplasty surgery. Now, for most of our patients, you can expect some degree of swelling and bruising potentially that resolves in 1 to 2 weeks. Now, you may see your rhinoplasty results start to take shape pretty shortly after, but recognize that there's swelling, and the swelling is asymmetrical often and may resolve at different rates. So it really takes a full year for most of our patients to see their rhinoplasty results, and even longer if it's a revision surgery. Number two, how do you manage the discomfort and the swelling after surgery? So for all of our patients who undergo rhinoplasty, we make sure we prescribe them pain pills that you could use if necessary, especially during the first 48 hours after surgery. Now, it's really important that you don't try to tough it out after rhinoplasty. If you have discomfort, if you have pain, please take the medications, because that'll also help keep your blood pressure in check so you don't have more swelling. Now, to manage the swelling after surgery, there's a number of things that you can do. Number one is to try to stay as upright as you can throughout the day so you have gravity to help draw a lot of that swelling out. And then in the evening when you're sleeping, try to sleep more propped up, especially in the first 72 hours after surgery, so the gravity can take the swelling out of your nose and out of your cheeks. Number two is you can ice your cheeks. And I'd like to recommend patients get the little Ziploc snack bags and put some frozen vegetables in, and those conform really nicely to the cheeks and work very well. You just need to ice 10 to 15 minutes at a time, 4 to 5 times a day, and that'll help keep a lot of the swelling and the bruising at bay. Three, make sure you curtail your physical activity, especially in the first week after surgery. And you want to avoid lifting anything that's too heavy, avoid bending over, and for sure, avoid exercising, because all these activities can raise the blood pressure in your nose and cause more swelling, and in some extreme cases can actually cause a nosebleed. Number four, you want to watch your diet and make sure you don't eat anything that's too salty. Salty foods can cause the nose to swell more and could also prolong the healing process. For those who want to take supplements, we typically recommend arnica and bromelain supplements, which could help decrease swelling, bruising, and inflammation. And we typically recommend starting about 3 days before surgery and continuing it until a week after surgery. Number three, you want to make sure you protect your nose following your rhinoplasty surgery. The nasal structures are very delicate, and trauma to it could potentially shift the nasal bones or the grafts that were used. Most common sources of injury that I've seen after rhinoplasty are inadvertent headbutts from children and dogs. So you want to really make sure you're careful around them. We ask that you don't wear any glasses that rest directly on the nasal bones for 2 months after surgery. If you do need to wear your glasses for reading or driving, we could provide you with other instruments that you could use safely without potentially injuring the nose. And we also ask our patients to avoid any tight-fitting masks, such as N95 masks or snorkel masks, for 3 months after surgery, so we make sure we really allow the nose to heal without any external compression. Let's talk about exercise. This is probably one of the most common questions that people considering rhinoplasty ask me is, when can I start exercising again? So as mentioned earlier, we want to make sure you don't do too much in the early period after surgery. And so I ask my patients to abstain from exercising during the first 2 weeks after your rhinoplasty. You can walk around as much as you want, but that's about all I want you to do. After 2 weeks, you could start some light cardio. This is like using a stationary bike or an elliptical machine. And then at 4 weeks, if you're doing well, then you can start weightlifting, yoga, Pilates. You can start a little bit more strenuous exercise. Now, these are just guidelines. I want you to use your best judgment. And if you're doing an activity and you feel that your nose is feeling tight or throbbing or hurting, if you have any of those symptoms, then it's probably too early. And I would say stop whatever you're doing and wait another week before trying it again. Number four, it's actually really important to make sure you maintain your nasal hygiene after surgery. After surgery, you could expect more mucus, potentially a little bit of bleeding, and those can form crusts. And those crusts can block your nasal passages and obstruct your breathing. They could collect bacteria and potentially lead to infection, or they could block your incisions and then slow down your healing. So it's actually really important to maintain good hygiene of the nose and remove and clean mucus and crust so you can have a smoother recovery. Now, every time you come into the office here, we're going to clean your nose, but at home, there's also some work for you to do as well. And of course, we will show you exactly how to take care of your nose when you come in for your post-op visits. Number 5, I can't stress enough that patience is key when it comes to rhinoplasty. I know a lot of our patients have been thinking about having rhinoplasty surgery for a long time, and so when they get the surgery, they can't help but want to see their results right away. However, we're biological beings and everybody takes time to heal, and there's simply no rush in the process. So it's important for our patients to make sure that you find some of the positive changes that you already see during the early recovery period, and to make sure that you trust the process and understand that you're not going to see your results right away, but the nose will continue to improve as it heals over the course of many, many months, and you'll be able to enjoy long-standing results once you're all healed up. The rhinoplasty recovery requires diligence, patience, and self-care. It's really important after surgery to follow the instructions that we've given you to ensure a smoother recovery. It's also important for you to make sure you come to your post-op appointments so we can take care of you and provide you with further guidance. Remember to be patient with your recovery process, your healing and the swelling, and embrace the positive changes that you see during the process. In time, you'll emerge with improved self-confidence and satisfaction with your nasal appearance.